So today I'd like to talk to you about how to take an NCLEX type exam. As you know, many of you have already taken tests with these types of questions. Just knowing the knowledge is not always enough to understand how to answer the question. You have to be able to take that knowledge you've learned and apply it to the situation so that you can determine the best answer and the best way to answer the question. So we're going to talk about some critical thinking skills, some methods that can help you narrow down the answers when you're unsure, maybe you don't even know the answer, to help you be more successful on these exams. So many times, nursing school exams really do make you feel this way. Which one is the most orange? You look at the answers, and it's sometimes hard to distinguish what the answer should be because they're all right in some form or fashion, and that does happen. Sometimes they are all correct, but you're looking for the best, and we'll talk about there are key words in the questions sometimes that lead you to which is that best answer. So first we'll talk about there are parts or ingredients of a question. So the first part is that case study, that background. This is your patient. This is your situation. And then your query or your question, it's asking you, what are you looking for? Your options are your answers. The subject is what it's actually talking about. And sometimes this isn't always as obvious. If it's talking about symptoms of a patient, it may not be the symptoms itself as the subject. It may be the side effects of a medication, for instance. So sometimes determining that subject and what it's actually asking for can help you determine better which answer. And then we're going to talk about strategic words, words that can change the entire context of a question or really help you narrow down what you need to focus on. So there are four main areas that your NCLEX test will cover. As noted on the screen, safe and effective care, maintenance and promotion of health, psychosocial integrity, and physiological integrity. In all of your courses on your introductory documents, there is a document loaded called the NCSBN Blueprint. Now, if you're in the PN program, it'll be the NCSBN PN. If you're in the ADN program, it'll be the NCSBN ADN. And this is basically a blueprint that the National Council for State Boards of Nursing writes to really give you an outline of what is covered. It helps you kind of prepare for that NCLEX exam. So you can use this to essentially create your own study guide, like what I've done in class sometimes when I've given you outlines to help prepare for a test. It's kind of similar. It can help you create kind of your own study guide to figure out where maybe content-wise you need to work on. And it tells you like percentages, how much is included in each category, for instance, to give you an idea. So let's start with one example and look at the parts of the question. So we talked about there are different parts. So in this example, the case event is the nurse is reviewing laboratory results of a client receiving magnesium sulfate by IV infusion and notes that the magnesium level is 3.5 milligrams per deciliter. So the query or the question is based on the laboratory result, the nurse would most likely expect to note which finding in the client. So basically this subject, if we jump down to subject, what this question is actually looking for is whether you know appropriate magnesium levels and what symptoms of inappropriate magnesium levels are, so that you know how to do that. So our options or our answers that are available are tremors, hyperactive reflexes, respiratory depression, and then no specific findings because the value is abnormal. So first you need to think in your head, is this value normal or is it abnormal? If you realize that this is an abnormal value, then you can automatically know 4 is wrong. So the correct answer in this is number 3. So number 3 is respiratory depression, and that if you know what the symptoms of that incorrect magnesium level is, then you will know that is the correct answer. But I'm going to talk about another second technique we can use in this question as well if you didn't know that answer in a little bit. So strategic wording, I mentioned. There are certain words, and you've seen this in many questions, that change the entire context or help you better determine what that answer is. So all the answers may be correct in some fashion, but that strategic word determines which one is the most orange or the most correct. So things like best, early, late. So when we're talking about, for instance, signs of shock. Whether it's asking for early signs or late signs could totally change your answer. Effective, like the most effective. Essential, what is absolutely needed. What are you going to do first? And this can be written as a priority. What is the first step? What is the first intervention? Different ways they'll word it. Next, what do you do next? So if it's already given you in the question that you've done an assessment, your next step is probably potentially not going to be an assessment, it's going to be an intervention. Most is another one, and you'll see most, best, a lot of those are very similar, they just use different words. Need for further, you see this a lot, need for further teaching, need for further follow-up. This is basically, you see this a lot of times with questions where what reply by the patient would indicate further teaching is needed. This is where you're looking for the patient giving you the incorrect answer. So need for further follow-up or teaching is kind of looking for which answer would be incorrect if the patient gave it to you. Vital, primary. So these are all examples of words you may see that can completely change the context of the question. So then you have positive or negative event queries under those strategic wording. Like I mentioned, some of them, what I mean by negative, are ones that are causing you to look for that incorrect answer. So that need for additional teaching, need for additional follow-up. What would be ineffective? What would be least helpful? What would show that the patient has not met the parameters they need? Negative meaning you're looking for that incorrect answer. So make sure you're paying attention in the question. I know lots of people that miss questions because they miss that one strategic word of what would indicate further teaching or what would indicate they have not met the parameters they need. Versus positive, you're looking for a correct answer, and you see that can go under lots of those, including select all that apply. Select all that apply is a positive strategic word. You're looking for everything that would fall under those correct parameters. So let's do an example of a positive query type of question. So in this question, the client with a suspected active lung tuberculosis is being scheduled for diagnostic testing. The nurse anticipates that which diagnostic test will most likely, I put that in bold because that's our strategic word, which diagnostic test will most likely be prescribed to confirm this diagnosis. So as we go through our selections that we have available, we have chest x-ray, we have skin testing, we have sputum culture, and we have a white blood cell count. Now, as you know from talking about tuberculosis, all these are potential things that you may use when it comes to somebody either with active tuberculosis or a history of tuberculosis. But we are looking for the one that would be the most specific to this diagnosis of having an active infection. So the other answers, the one that is correct, which I'll tell you in a minute which one is correct, the ones that are incorrect are more of screening tools, and that's the way you could narrow this down. There is one answer that is very specific, that gives you very specific diagnostic material, versus the other three are more screening. So the correct answer in this case would be 3. That's sputum culture. Chest x-rays, skin testing, and white blood cell counts are just a superficial screening tool. They're not going to give you very specific information, versus a sputum culture. It can actually be looked at under a microscope and you can determine the exact cause of their infection, whether it's tuberculosis or not. So that one is the most specific, and that's where most likely would be that strategic wording to help you figure out which one of these answers is correct. So another example with a negative query. So we are looking for essentially an incorrect answer, or what would be a negative query. So in this case, the nurse is reviewing the nursing care plan of a hospitalized client with sickle cell crisis. Which client problem is the least priority? So what we're looking for in this question when we say least priority is something that we would not be worried about right now. Now, if you look at all these answers, you see generalized pain, signs of dehydration, inability to cope with disease, lack of perfusion to peripheral tissues. So again, all 4 of these answers could potentially be correct as far as things that we would do for a patient with a sickle cell crisis or even a chronic illness. But we are looking for which one are we the least worried about. And I'm going to talk about later on about Maslow's hierarchy of needs, but this would fall under that Maslow as well, because as you know, when you are analyzing priority questions, Maslow is one of those techniques you can use. So Maslow is the triangle and your most important needs are at the bottom, your safety, security, and physical needs. So physical needs are always going to come over psychosocial needs. So when we're reading these, generalized pain is a physical problem. Signs of dehydration is a physical problem. And lack of perfusion is a physical problem, but inability to cope is a psychosocial problem. So in this question, you can look at the fact that that would be your least priority at that moment, because your physical problems are going to come before your psychosocial problems. And that that can also, another technique we're going to talk about, if you look at the differences in them and you're able to group the other three answers as physical problems, and that one is your only psychosocial problem, that could give you a clue as well, because it's very different from the other examples. So moving on to prioritization, I already talked about that a little bit with the Maslow. You see the Maslow's hierarchy of needs pyramid down in the bottom left-hand corner of your screen. There are multiple ways we use to prioritize and delegate. And NCLEX really likes to focus on prioritization because it is something that really assesses your critical thinking skills, not just what do you do, but what order do you do it in? What would be the best way to approach care to a patient to do it in the correct order? So some of the techniques that you'll see is your ABCs, and you've heard ABCs. Don't forget ABCs and call for help. When you did your BLS CPR class, one of the first things they teach you, you establish level of consciousness, and if they're unconscious and don't have a pulse and aren't breathing, you say, hey, you, go get help. So part of that prioritization as well is not just ABCs, but also getting help and not leaving the patient. So as you know, ABCs means airway, breathing, and circulation. So first you're going to do airway, and the reason these are your priorities are these are the ones that are going to have the most potential life-threatening effects. So if you have a broken leg, for instance, while that's important to assess, if they're not breathing, that broken leg's not going to matter shortly because they're going to die. So your ABCs are the parts that are going to most directly be life-threatening, and that's why they come first. So I mentioned the Maslow's hierarchy of needs already. Again, your physical needs come first. Another way that people call it soma before psyche, your physical needs before your psychological or psychosocial needs. So your physical needs, your safety and security, things like that are priorities. And don't forget that also things like risk for falls, safety, whether it be mental health. Safety also includes infection risk. So washing your hands, for instance, is a priority because it helps with that safety, which is a physical need. Also using the nursing process. For those of you that have had me, you've heard me say many times, assess and lessen distress. I've beat it into you. And it really is a good way to help you remember. So unless the patient, something is going on with the patient at that moment, where if you don't take immediate action, there's going to be severe consequences. An assessment piece is going to be your priority in that instance. So first you need to fully figure out what the problem is before you actually assess the patient. For instance, if you have somebody who is, and when I mean distress, this is not just physical distress. This could be a safety risk. Going back to Maslow, for instance, if you have a question where you are walking with a patient in the hallway and they complain that they're feeling dizzy, your first action is not going to be to assess the cause of their dizziness. It's going to be to sit them down, because at that point it is a distressing situation in the sense of if you don't do something right now, they have the potential for a fall. So you need to address that first before you figure out what the problem is. And then infection control. Infection control, like I mentioned, kind of goes in that soma before psyche, because this is a priority as well. This includes when a patient has an active infection, for instance, putting them on isolation precautions is always a priority. And this is because you want to limit that spread to others before you actually take care of that patient. So when you have questions like a patient comes in with active tuberculosis, what is your priority intervention? It's going to be to put them in a negative pressure room because you need to address that infection isolation first. And then another thing as far as delegation, so on your right hand of your screen, it talks a little bit about prioritization and delegation. And these sometimes go together. Your higher priority patients, for instance, can't be delegated. And we'll talk a little bit more about specifics of delegation, but prioritization and delegation, with both of them, always think of stable versus unstable. So your priority patients are going to be your immediately unstable, acute patients, and those are patients you can't delegate, versus your chronic needs, your basic needs, and your more stable patients are lesser of a priority, and they are more likely that they could be delegated. So here's another example. The nurse is caring for a client who has just returned from the recovery room after a tonsillectomy. The client is restless and the pulse rate is increased. The nurse continues to assess the client, and the client vomits a large amount of bright red blood. What is the immediate nursing action? So in this question, our strategic word is immediate, and it's asking, what do you do first? What do you need to do? So our options are: 1, call the surgeon; 2, continue to assess the client; 3, obtain a flashlight and gauze; and 4, check the client's blood pressure. So there are multiple techniques you could use with this. If you look at, there are 3 answers, for instance, that are all assessment answers: continuing to assess, obtaining a flashlight and gauze, which is what you would do to assist with the assessment, and checking the blood pressure. They're all assessment answers. So just the fact that they're all similar could group them and put them away, and you only have one that's different, which is call the surgeon. Another thing is that assess and lessen distress. So in this case, the patient is restless and the pulse rate is increased. When you see those, you know that more than likely they are hemorrhaging, because your heart rate's going to go up and they start having the neurological confusion, restlessness, things like that. And that's a sign of hypoxia in this case, or low volume. So again, our strategic word in this case is immediate. We need to know what we have to do right now. When we look at the subject, and let's go back to the question, when we look at the subject, again, the subject is determining symptoms of hemorrhage. So we've been given a patient situation where hemorrhage is very likely, and then that restlessness and pulse rate, increased pulse rate, really indicates that something is going on. So understanding that subject, that the symptoms of hemorrhage and shock. So in this case, when you have a post-operative hemorrhage, with the answers that are given to us, the best answer is to call a surgeon, because the doing further assessment methods is going to delay life-saving treatment measures to the patient. In this case, they are in a distressing situation. They're going into shock due to their hemorrhage. So the provider is needed, because especially since this is a tonsillectomy and it's an internal surgery, we cannot as nurses stop the bleeding. The surgeon needs to do that. So you have to call the surgeon. And like I said, all the other answers are assessment answers, or in some way assessment answers. So techniques to use in this question: assess and lessen distress, and this is a distressing situation. And another example is that alike or similar answers, which we're going to talk about a little bit more as well, but all those other answers being alike, that they're assessment types of situations, could help you narrow that down as well. So in this question, a nurse is caring for a post-operative client who suddenly becomes restless. The nurse should take which most appropriate action? So what is most appropriate? So you see, this question is very similar to the last question, because it's somebody who's post-operative and suddenly becomes restless. So your first thought after we talked about the last question is notify the surgeon, right? Wrong. So let me tell you what the difference is in these two questions. So in the last question, it was very specific. We had vital signs. Because we knew that they were becoming tachycardic, they were restless. It was a little more specific by having that little piece of the increased pulse rate. Just that little bit makes all the difference. So the most appropriate action in this case is actually to do an assessment, which is check the client's vital signs. So in this case, it's very non-specific. There's nothing in the question to indicate that something is wrong, as far as that they may be bleeding or going into shock. There's no indication of active bleeding. It doesn't tell you there's a hemorrhage. So we need to get more information, because restlessness in this case is very subjective, and it could be medications that the patient was given in surgery. It could be a lot of things. So because this one is less specific than the other one with that little bit of wording with the increased heart rate, this case, it would be number 3, check the client's vital signs. We wouldn't medicate them for pain. And again, that could be another cause of their restlessness, is maybe it's just that they're in pain and they're not able to express it the way they need to. So in that case, of course, we'd need to assess first to figure out if that's the cause, but we wouldn't automatically do an intervention. So again, in this one, the provider is not the priority. So the strategic word that we're looking for, most appropriate. Another difference was the fact that we didn't have vital signs, so the information was not as specific. So we would need to look to get more specific information before we determine the cause. And the way that question's worded, we can't determine the cause very well. So the subject we're looking at is a restless, non-specific postoperative patient, and that non-specific is what's important. So with our options, again, the best way to determine this is there is no indication the patient is in pain. There's no indication they're hemorrhaging. You don't know. They're just restless. So you need to figure out what's causing that before you start taking measures to address it. Do not read into information that's not there. And I know that's very easy to do when you read that one question with the increased heart rate, and then you read that very next question that, while it has very similar content, it's worded quite differently. You might read into it that they have vital sign changes when nothing in the question indicates that. So make sure you're not reading things in the question that just aren't there. Don't make assumptions. There's a question I've had before where you walk into a room and somebody is bleeding. And what is the first thing you do? And people want to put that you apply pressure to the site, but the correct answer is put on gloves. And students will tell me, I assumed they had gloves on. You can't assume that. And if it was not in the question, it did not happen. So you need to not make any kind of assumptions that are just not there. So in this next example, we're going to talk about using ABC technique as a priority. So in this question, a client with a diagnosis of cancer is receiving morphine sulfate for pain. When preparing the plan of care for the client, the nurse should include which priority action. I didn't bold it in this question because I wanted you to be able to pick out which is your strategic word. So when you read it, I'm sure you've read it, you probably already picked out the priority as kind of that strategic word. What is the most important thing here that you're worried about? So in a client with a diagnosis of cancer receiving morphine sulfate for pain, basically the subject is looking for what are things that could potentially be adverse effects of somebody receiving morphine sulfate. It's looking for essentially adverse effects of morphine. So monitoring stools, monitoring urine output, encouraging fluid intake, encouraging the client to cough and deep breathe. Well, all these are important. All these are orange. They could all be the correct answer. They can get constipation very easily. They can get dehydration and decreased urine output, or and that kind of goes with that encouraging fluid intake as well. And then, of course, because they often have decreased gag and some respiratory depression, they may need to, like an immobilized patient, be encouraged to use an incentive spirometer or cough and deep breathe. So all of these could be Correct. But we need to find the priority, and that is where ABCs come in. So the most important priority action in this case would be encouraging the client to cough and deep breathe, because that addresses the airway. Bowel function is important, urinary function is important, and hydration status. They're all important, but if you don't have an appropriate airway or breathing, none of those are going to matter. So ABCs are first. Again, the strategic word in this case was priority. What is the most important? And the technique we're using here is our ABCs. Our subject is that morphine sulfate implications, possible adverse effects. You're looking at adverse effects of morphine and which one are the most important to address. And again, airway is your priority in this case. While all of the answers should be part of your nursing care plan, addressing the airway is top priority. So our next example is going to be related to Maslow and using Maslow's hierarchy of needs to determine our answer. So in this question, the nurse is preparing to teach a client how to use crutches. Before initiating the lesson, the nurse performs an assessment on the client. The nursing priority assessment should include which focus? So the answers that were given are the client's feelings about restricted mobility, the client's fear related to the use of crutches, the client's muscle strength and previous activity level, the client's understanding of the need for increased mobility. So one technique you can use, again, when I talked about like and similar answers, sometimes those can help. 1, 2, and 4 are all similar in the sense of they're psychosocial related or cognitive related. But really the one I want to focus on for this example is Maslow. So when you look at these answers, there is only one answer that is related to physical. Remember, soma before psyche. Physical needs, safety come first. Psychosocial needs come second, always. So in this case, again, look back at the question before I flip to the next page and tell me, can you pick out that strategic word in this case? So that strategic word was priority. What is the most important? And again, all of those answers were important. You do need to address the psychosocial effects of immobility and different techniques with your patients, but it is not the priority. We are looking for priority. So with priorities, you're looking for your ABCs, you're looking for Maslow, and you're looking for the nursing process, which we're about to talk about. So again, the strategic word is priority. The subject, we're looking at crutch teaching. That is the basis of the question. So when we look at those options, when we use Maslow, there was only one option that was a physical need. All the other ones were psychosocial or cognitive. So that would help us, using Maslow's hierarchy of needs, determine that assessing that muscle strength is what's most important because it is physically related. So like I said, we're going to talk about the nursing process too. The nursing process is also a technique you can use. So your assessment comes first, again, unless they're in distress. So assessment, planning, diagnosis, interventions, evaluation. So using that process and making sure you're looking at the question. Sometimes the question will already have that assessment in it. If it's telling you that you have checked their level of consciousness and their pupils and all this stuff, and then one of the answers is to check their neurological status, well, you've already done that. So don't repeat something that's already been done in the question. So in this case, a nurse is teaching a client with coronary artery disease about dietary measures that should be followed. During the session, the client expresses frustration in learning the dietary regimen. The nurse should take which initial action? So our options are continue with dietary teaching, identify the cause of the frustration, notify the healthcare provider, tell the client that the diet needs to be followed. So when you look at these answers, one way you can eliminate 3 of them is that there are 3 of them that are very similar. They're all interventions. Continuing with teaching is an intervention, notifying the provider is an intervention, And just telling the client that they need to follow the diet kind of goes under that teaching intervention. But plus, we should already be able to eliminate that one, because that's not a therapeutic method of communication with any patient. So the correct answer in this case is you need to assess, or in this question it uses the word identify, the cause of the frustration. So in the question it does not tell you why they're frustrated. And in order to tailor your information to best meet their needs, you got to figure out the cause of that frustration before you can address that frustration. And again, this goes into that using your nursing process. The first thing you're going to do, there's no indication the patient is in distress right now that could be potentially life-threatening if you don't take action. So there's no need to jump to that. You can go through the nursing process, and the first thing you're going to do is that assessment. So again, read the question, see if you can pick out that strategic word. So that strategic word was initial. So in this case, you need to look at what is the most important first thing you need to do with this patient. And in this case, we're using the nursing process. The first thing we do is assessment. So the subject of this is dietary teaching, although really in this case, even if you didn't know anything about dietary teaching, you could use these techniques to pick out the correct answer. And that's why these techniques help sometimes even when you don't know the correct answer. They can help you narrow it down to something more likely. So delegation, I mentioned a little bit about delegation, but things that you can and cannot delegate. A lot of times questions will have both practical nursing delegation and CNA delegation. So there may be some differentiation in what you can give to an LPN or a CNA. So you'll have to know those differences as well. So as far as your CNAs, well, really with both of your CNAs and your LPNs, you can delegate tasks, but you cannot delegate assessment or interpretation. So you can have, you can delegate obtaining a pulse oximetry reading, but you can't delegate that they determine the cause of that abnormal pulse ox reading. They can't assess or analyze any of the information. They can only collect the information. They can also provide, you can delegate encouragement, but not education. They cannot, both LPNs and CNAs cannot provide education. So what I mean by the difference is you can delegate to the CNA to go every hour, every 2 hours to the patient's room and remind them to use their incentives barometer. But if they go to that patient and the patient says, I don't know how to use this, I need you to teach me, that can't be delegated. If they're actually showing them how to use it, they can't be delegated that task. The RN has to do that. But if they're just merely reminding them or encouraging them, that can be delegated. Stable or unpredictable patients also cannot be delegated to LPNs or CNAs. Especially if it's very non-specific in the question, what could be the problem? If a question states to you, for instance, that the patient, the CNA comes and tells you that the patient is acting funny, the correct answer is you cannot send them to get a blood glucose because that requires assessment of the cause. In that instance, that patient is considered unstable. They're having some kind of symptom at that point, so you need to assess the cause of that symptom. You're not going to automatically provide an intervention because you don't know what the cause of that is. It could be acting funny, could be a lot of different things. So your interventions are going to be related to you as the nurse going to assess that patient yourself, whether it be checking vital signs or getting a blood sugar or whatever it be. It needs to be a further assessment by the RN. Anybody who is stable or unpredictable cannot be delegated. And a lot of times they like to use questions telling you this is the staff that you have today. You'll have one LPN, one CNA, and yourself. which one can you delegate to the CNA, for instance. So you'll need to pick those out and figure out what would be the best assignments. Now, one thing that's different for LPN delegation versus CNA delegation is medications and invasive procedures. So CNAs, you can never delegate medications or invasive procedures ever. This includes IV starts, and I know technically they do those in the hospital as far as with CNAs, people get trained, but as far as NCLEX purposes, they can't do things like Foleys and IVs and all this stuff. They're considered invasive procedures, and they certainly can never give any medications. Now, LPNs are different. They can give medications, but you need to know what medications they can and cannot give. For instance, LPNs can't give chemotherapy. They cannot give blood products, and they can't give IV push medications. So while they could administer an antibiotic that's in a bag, or they can monitor and hook up IV fluids, there's a lot of medication. So if it's an IV medication, they may be trying to trip you up with knowing whether the LPN can or cannot give that. So anything that requires a lot of thought process and analysis, generally think of that as a non-delegating type of thing. So I mentioned LPNs and your UAPs. A lot of times you'll see it listed as your unlicensed assistive personnel. So I need to make sure you know that term. That's what they're talking about when they talk about that. They're talking about your techs, your care partners, your CNAs, your assistive people that don't have a license to practice. So both LPNs and your unlicensed assistive personnel can assist with any kind of standard ADLs. They can do transportation, they can do positioning, they can collect specimens, they can do range of motion, they can do encouragement. Again, they can't teach procedures, but they can encourage the patient. So those basic daily tasks. So in addition to those tasks, the licensed practical nurse or the LPN can also do certain medications. They can do dressing changes. They can do wound care. They can do suctioning. They can monitor IVs and their flow rates and stuff. But there are some medications, make sure you're paying attention, whether if it's asking about a chemotherapy medication, nobody but an RN, for instance, can give that. So to help determine that delegation, in this question, the nurse is planning client assignments for the day and has a licensed practical nurse and an unlicensed assistive personnel on the nursing team. Like I mentioned, they like to do that a lot, where they give you your team for the day and you need to figure out the best assignment. So the nurse most appropriately, that's your strategic word, assigns which client to the licensed practical nurse. So then we analyze the clients that were given to figure out how we would do that. So a client with a tracheostomy who requires frequent suctioning. Could that be a possibility? A client who requires collection of urine for a 24-hour period. That could be correct. They can collect specimens. A client recovering from pneumonia who requires ambulation every 3 hours. Again, that could be correct. That's a basic activity of daily living, ambulating the patient. They can do that. Number 4, a client who requires turning and repositioning every 2 hours and range of motion exercises every 4 hours. Again, this one could also be correct. So when you read these answers, all of them could be correct. There is no medication administration listed that would be inappropriate for the LPN. There is no unstable patients, tasks of teaching. Like for instance, if it was a new admission, that's something you wouldn't be able to delegate because it requires an extensive assessment and admission teaching. So the best answer in this case would actually be number 1, the client with a tracheostomy who requires frequent suctioning. And again, what makes that correct is if you look at options 2, 3, and 4, those are all patients that could actually go to the unlicensed assistive personnel. They're all basic ADL tasks or fluid collection, or specimen collection, that can be done by the unlicensed assistive personnel. So the way you determine this, even though all of them could be to the LPN, you need to determine actually which ones would have to go to the unlicensed assistive personnel first, and then determine which one could not be given to the unlicensed assistive personnel. And you see that one's different from the other answers, and that's how you separate that out and decide that. So again, your strategic word was most appropriate. The subject of this is knowing the scope of practice for your LPNs and your unlicensed assistive personnel. You have to know their scope of practice just as well as you know your own when it comes to that delegation. So like I mentioned, all options are stable patients that just require routine care, so they can all be delegated to the LPN. The difference with option 1 is it's an invasive task, it's suctioning, and unlicensed assistive personnel cannot do that, versus the other questions, the unlicensed assistive personnel could take those patients. So that was the difference in that. So let's talk about everybody's favorite kind of question, a select all that apply. And the best way to approach select all that apply questions is use it as a true or false with each statement. So in other questions, when it's only one right answer, you can kind of critically think through and eliminate some of the answers. You can't really do that with select all that apply because every answer could or could not be correct. So you use a true or false approach. So in this question, the nurse is planning client assignments for the day and has a registered nurse, a licensed practical nurse, and an unlicensed assistive personnel on the nursing team. Which clients can be safely assigned to the licensed practical nurse? So in this case, it's not where you can do process of elimination. You have to know that scope of practice. So our answers are client scheduled for an ultrasound of the heart. Pretty routine, nothing in there that determines that teaching interventions or, teaching assessment or any of those higher level interventions are needed. A client with an open abdominal wound who requires wound irrigation every 3 hours. Well, LPNs can do wound care, so that could be a possibility. A client with a spinal cord injury who requires intermittent urinary catheterization every 4 hours. There's nothing to indicate that it is a unstable patient. Spinal cord injury doesn't necessarily mean unstable. Client newly diagnosed with diabetes mellitus who requires teaching on insulin administration. Well, we can already look at that one and determine that's going to be incorrect because they can't do teaching. Client with pulmonary edema admitted 2 hours ago and requires frequent respiratory assessments. That's another one we can eliminate because just the fact that assessment is in there is one reason we can't delegate this to an LPN, and another reason is because of the potential for this patient to be unstable, being a new admission with pulmonary edema. And the last one, a client with a central IV line receiving TPN and has a prescription to receive 2 units of packed red blood cells. Well, if it was just the TPN, yes, that LPN could do this. But the fact that they added on that 2 units of packed red cells, again, we already know that is an incorrect answer. So let's look at these. Again, number 1, yes, that is a true statement. The LPN can take care of a patient that's scheduled for an ultrasound of the heart. It's a routine task as far as transporting the patient, taking care of the patient. There's no indication that they're unstable at this time. Don't read into it. Just because they're getting an ultrasound of the heart doesn't mean they're unstable. A client with an open abdominal wound, again, we talked about this. Yes, that's someone they could take care of because they can do wound care. There's no indication that teaching or assessment is needed. Although, yes, I know when you do wound care, you're assessing the wound, and that's where it gets hairy sometimes differentiating, but in the question itself, all it's talking about is the actual task of wound care. So number 3 with the spinal cord injury, again, this patient is stable. It is a routine procedure. It doesn't need teaching or assessment. This is a patient that gets intermittent catheterization. So this is a patient also that the LPN could take. And then the last 3 we already talked about are no. 4, you have to do teaching. LPNs can't do teaching. Number 5, assessment. You can't do an assessment. And with number 6, it requires you to give packed red blood cells, which LPNs cannot give blood products. So that would make that the incorrect answer. Again, the best way to approach select all that apply answers is to use a true or false mindset with each individual answer. Is this true or false based on the question? So some of these I've already mentioned, such as using similar and alike answers, but I'm going to talk about some other techniques for picking an answer that I've talked about some of them, but we'll talk about more detail. So again, make sure you read the question. And I know that sounds basic, but reading really is fundamental. Do not add things into the question that simply aren't there. Do not read into the question. Do not assume and place assumptions. If it's not in the question, it did not happen. Make sure you know what it's really asking. And again, those key words, strategic wording helps with that. Another important part is to ensure all parts of the option are correct. If you have a question where it gives you, like for instance, 2 symptoms with each answer, make sure they're both correct. And it's not just, don't just immediately see, oh, tachycardia I know happens with shock, so I'm going to pick that one. But if it's tachycardia and hypertension, the answer's incorrect because you would have hypotension in that case. So make sure both answers, if it gives you multiple portions in the same answer, that all of it is correct and not just part of it. So some tips of process of elimination, opposite answers. So if you have, for instance, an answer of tachycardia and an answer of bradycardia, more than likely one of those is going to be correct. A lot of times when you have completely opposite answers, they are going to be one of them correct. Similar and alike answers. This is one I've talked about several times, and you can use this a lot for NCLEX type questions. Whenever there are similar answers, sometimes they can almost be identical, just in a different word, and that's why knowing your terminology is very important. Both are going to be wrong because you can't pick one or the other if they're that similar. So both are going to be wrong. So then you have umbrella answers, and I'm going to talk a little bit more about umbrella answers, but basically what umbrella answers mean is that when you have other answers that can fit up under one of the answers, that broadest answer is going to be correct. For instance, let's say you have a question that asks about what is the best way to prevent infection spread, and your answers are A, wash your hands, B, wear your gloves, or C, use standard precautions. In that case, your answer would be use standard precautions because wearing gloves and washing your hands falls under that umbrella of standard precautions. Part of that is nursing knowledge. While there are techniques to help you narrow down and eliminate, even if you don't know the answer, you have to have a level of nursing knowledge. So that's kind of an obvious one, and you have to know how to take that knowledge you've learned and apply it to the situations. Another process of elimination is absolute answers. If it's an absolute answer, it is going to be wrong. There's always gray areas. So if an answer says something about always, the patient always does this, this always happens, this never happens, everyone, all or never kind of answers, they are wrong. Look for similar wording in the question and the answer, and a lot of times that will clue you in as well. If in the question it talks about increased heart rate and then one of the answers has tachycardia in it, that's probably the right answer because they'll include similar words or synonyms of each other. And again, that's another reason why knowing your terminology is very important. And do not look for answer patterns. The NCLEX is a very smart test. It gives you random orders of questions, so it's very possible that you'll get 5 or 6 questions in a row where the answer is C. Don't automatically start thinking, well, I've answered C 5 times. This question has to be a different answer. Don't focus on that because the questions are random and there is no way to determine how many questions you're going to get in a row that could have the same answer. If you feel that that is the right answer, even if this is the 50th time you've put C in a row, put that C. Don't assume because you keep using that it is wrong. So let's do a practice question. So in this example, our case event, I talked about in the beginning, the portions of the question, your case event or your story behind it. And again, this is the same one we did before. I mentioned when we talked about the magnesium sulfate, that I had another technique for you for this question. So we're coming back to this question. The nurse is reviewing the lab results of a client receiving magnesium sulfate by IV infusion and notes the magnesium level is 3.5 milligrams per deciliter. Our question asking, based on this result, the nurse would most likely expect which finding? So we already know 3 is the correct answer because we've talked about this question, but let's talk about another way you can analyze this. So again, the first way you can knock out one of your answers is knowing whether that 3.5 is an appropriate level or not. And we know it's not. So 4 is gone. We already know 4 is not an option because we know it's in an inappropriate level. So then we look at our other answers. Tremors, hyperactive reflexes, and respiratory depression. Tremors and hyperactive reflexes are very similar alike answers. They're both hyperactivity of the nerves, essentially. So, guess what? That's how you can eliminate those as well. Even if you could not remember the symptoms of magnesium sulfate being too high, you can look at determining, well, I can't remember what it is, but tremors and hyperactive reflexes are basically the same thing. So 3 is the only one that would make sense in this case by eliminating the others. So again, answer 4, you can automatically eliminate just because you know that that is an inappropriate magnesium level. But then on the others, if you can't remember, well, I know 3.5 is wrong, but I can't remember if it's high or low, and I can't remember which symptoms are high or low, use the answers to help narrow it down. If you have similar answers, neither one's going to be correct. In this case, the tremors and the hyperactive reflexes are essentially the same thing. So you can eliminate those, and that only leaves you one option left. So this is an example of using that umbrella answer technique. So our situation is, in a telephone call from EMS, the nurse in the emergency room is told that several victims who survived a plane crash are being transported to the hospital. That's our situation. Our question is, what is the initial? So we're looking for the very first thing you should be doing by the emergency department nurse. So our options are: call the nursing supervisor to activate the agency disaster plan. Number 2, supply the trauma rooms with bottles of sterile water and normal saline. Number 3, call the ICU to request that nurses be sent to the emergency department. Number 4, call the laundry department to request as many warm blankets as possible. Again, if you look at these answers, every single one is correct. They are all things you will do in a mass casualty incident. But we need to find, what are we going to do that's the best initial one? So if you look at the answers, 2, 3, and 4 can fall under that agency disaster plan. So the first thing you're going to do is call the supervisor, because when you call the supervisor and activate a disaster plan, all those other things that are listed get put into place as part of that disaster plan. So the agency disaster plan is that umbrella answer. All the other answers are encompassed under that disaster plan. So that's how you can identify, in this case, which one would be correct. Again, our strategic word was initial. The subject of this question is, we need to know what you do in a mass casualty incident or disaster situation. And the best way, and again, all the answers were correct. They're all things that will happen in a disaster plan. But the best way to determine that is using that umbrella technique. When we look at that, notifying the supervisor that to activate that disaster plan puts all those other answers into place. So here's an example of nursing knowledge and how you can use that nursing knowledge to analyze the examples that you have. So a client with type 1 diabetes mellitus describes shakiness and hunger 2 hours after receiving a dose of regular insulin. So you probably read that and you're like, oh, they have low blood sugar. We need to fix that. You've probably already figured that out. The nurse determines that the patient is having a hypoglycemic reaction. It goes on to tell you. It may not tell you, though. And prepares to give the client which best item from the dietary kitchen to treat the reaction. So automatically, everybody's head goes to orange juice, right? The first thing you think of to give a patient when they are having hypoglycemic reaction is give them orange juice. But then you read the answers and you're like, oh no, orange juice is not an answer. What do I do? So that's where you need to apply that application of some nursing knowledge to what answers are actually given to you. So when we read our answers, we have milk, we have diet soda, we have sugar-free gelatin, and we have sugar-free cookies. So what you would do with this, if you read the answers, diet products and sugar-free products have no sugar. So they're not going to do anything for a diabetic. So milk actually does have a decent amount of sugar in it. Milk can be used to bring that blood sugar level up. So our strategic word, again, is best. We're looking for the best one. And in this case, actually, it's not where all 4 answers are correct. Those other 3 answers are clearly wrong if you have nursing knowledge to know that sugar-free products and diet products do not have any kind of carbohydrates to help that patient. So our subject, we're looking for nursing actions in hypoglycemia. What do we do for a hypoglycemic patient? Another portion of the subject is knowing what has sugar in it. What is a carbohydrate source? So again, our nursing knowledge related to this is we know we need to give some item with 10 to 15 grams of glucose. So you need to know that milk has glucose in it, and that will help with the blood sugar, even though the answer you first think of, which is orange juice, isn't there. So don't panic if an answer you already have drilled in your brain as an answer is not an option, because if you analyze the other answers, a lot of times there's something similar. So this is an example that will address those absolute answers, the all or nothing. So the nurse is providing dietary instructions to a client about a low-fat diet. The nurse should make which statement to the client? So when you read the answers, never use butter for cooking. It has that absolute answer in it. Drink fluids only if they are fat-free. That only is an absolute. That's like an all or nothing. Eat foods that have less than 1% fat content only. That's that absolute answer. And then 4, read the labels on food items to determine fat content. That is our correct answer. We want to teach them to read the labels. And as you know, the same when we're doing teaching to clients, teaching assessment things is important as well. So they need to determine, for instance, which foods would be best by reading the food labels instead of giving them ultimatums. So again, the first 3 answers are all incorrect, and you can use the technique of looking at having those ultimatum or absolute answers, the all or nothing type of answers. There's no gray area. When there's answers like that, they are always wrong. So this is an example of similar words being in the question and the answer, and how if you know your terminology and if you notice matching similarities in words, you can kind of determine that that's probably a correct answer. So in this instance, a client is admitted to the hospital with a diagnosis of pericarditis. The nurse assesses the client for which manifestation that differentiates pericarditis from other cardiopulmonary problems. So our answers are anterior chest pain, pericardial friction rub, weakness and irritability, chest pain that worsens on inspiration. So if you look at these answers, 1 and 3, and even 4 really are very general answers. That's one technique you can use. Because we're looking for something that differentiates this specific problem, we're looking for a more specific symptom. So chest pain, weakness, those are all very general symptoms that don't tell you the problem. Versus pericardial friction rub is a little more specific. Now, if you forgot all about pericarditis and you could not remember the symptoms of pericarditis, this is where that similar words in the question and answer come into play, because you notice diagnosis of pericarditis in the question, and then of your answers, the only one that has pericardial in the answer is number 2. So you can use that technique as well to pick that answer out if you're unsure. So the strategic word in this case is differentiates. And this also kind of goes back to that tuberculosis question, which one is the best? The sputum culture, because that was most specific to the problem. It's going to tell you whether they have tuberculosis versus just a bronchitis, for instance, or a pneumonia. So it's more specific. Differentiates means it's looking for something specific related to it. So the subject, we need to know symptoms of pericarditis. But in this case, we're using that similar words in the question and answer to help narrow down what we're looking for. And in this case, option number 2 had the same option, or had the same word, pericardial, as the question then. So there's a few techniques, again, in that one you could use as well. So therapeutic communication. You've heard all about this many times. And I know we joke, and y'all joke, that oftentimes the right answer when it's therapeutic communication is the most ridiculous sounding one, but not always. And I know in your head sometimes the way they word things sounds ridiculous, but once you become a nurse, there are some of those you actually use to kind of delve more into the patient and understand what they're going through. So therapeutic communication, there are some techniques related to that. So some things you want to look at is you want to focus on the client. You are not the priority here, the client is. So if it's addressing you in some way as the nurse, that's going to be wrong. Open-ended questions are great. Question answers, for instance, that say, tell me more about this situation, instead of giving questions that are yes or no answers. Are you having pain? That's a yes or no question that's very non-specific and doesn't give you a lot of information. It's a closed-ended question versus an open-ended question. Tell me more about your pain. They have to go into a story, and you'll get more information that way. Paraphrasing, reflecting, and restating are all really good methods as well that you'll see in answers. When, for instance, it may reword the question. So it'll talk about, the question is talking about their anxiety, and then the correct answer may be something like, what I'm hearing is that you feel very anxious about this procedure. Tell me more about it. You're paraphrasing, you're restating, you're making sure you understand. You're also showing the client that you're listening. Validating the patient is also very important. And this kind of goes into that paraphrasing as well. You're confirming that you understood what they said. It verifies that you have interpreted what they've said correctly. And then giving them sympathy without empathy. So empathy is where you can put yourself in somebody's shoes. You've experienced the same situation. That's never going to be the case. Even if you are caring for a patient who has diabetes and you also have diabetes, you still cannot empathize with them because you're not exactly like them. Versus sympathy. Sympathy is where you feel sorry for somebody. So you can have sympathy. I'm really sorry for what's going on with you. But you can't tell the client, I know how you feel. That's always going to be an incorrect answer when you try to put yourself in that patient's situation and relate it to them. So some things you don't want to do. Don't worry is never an option. You can't, and this implies false hope. You can't tell them don't worry because you don't know what the outcome is going to be. Why? If why is in the question, it is incorrect. And the reason for this is why is often can be taken as defensiveness, and it implies criticism towards the patient. Why are you doing that, for instance? Why do you feel that way? Instead of that, you would say, tell me more about. And yes, essentially it's a why question, but just that why wording, you can eliminate that answer. You never want to persuade the patient. Those are always incorrect answers. And you don't want to tell them what to do either. That's another one that's very incorrect. You can't just tell them you just need to take your medications. You can't persuade them either. You can educate them and tell them why their medications are important to take, but you can't say, come on, let's take your meds. Don't imply patient unworthiness or ignorance. And sometimes this can be a little tough, but if it sounds something like you are implying that it's their fault something happened, for instance, if the patient is in an abusive relationship, and you say, what did you do to cause him to hit you? That's implying it's their fault that it happened. It's their fault, and you can't do that. So you can't approve or disapprove, and I mean, this is something you see in the medical field. Honestly, this is a truly ethical situation you shouldn't be doing anyway. When patients will always ask, what would you do? Ethically, legally, all of that stuff, you are supposed to educate them, but not give them your own opinion. You can't say, well, I would do the procedure, I wouldn't do the procedure. You can give them the information, but you can't help them with that decision. And again, that false reassurance, you can't give them false reassurance, and that goes back into that never saying don't worry. Giving false hope, false reassurance, you don't know the outcome. So if you say it'll be fine, everything will work out, all those are always wrong. So let's look at acknowledgement and assessment. So acknowledging the patient's feelings and assessing what they're trying to say. So the nurse is caring for a terminally ill client. The client's wife, who has served as the caregiver, is at the bedside, and she states, I really hope my husband can just get better so we can get home. Now, we've read the question and we're already thinking, well, if he's terminally ill, he's not probably going home. So what statement should the nurse make to the client's wife? Number one, has the doctor spoken with you about your husband's plan of care? Number two, it sounds like this is difficult for you. What do you know about your husband's condition? Number three, I hope your husband gets better too. It would be wonderful for you to be able to take him home. Number four, I've known this is a difficult situation. I've seen this many times before. The spouse always has a hard time. So when you look at these, number one is incorrect. Has the doctor spoken with you about your husband's plan of care? So on number one, all it's doing is asking if the doctor has spoken. One, this is a closed type of question. It's a yes or no question. You're not providing any help to the client. You're not providing services to the client that are totally in your scope of practice. You're not addressing the patient's feeling, and you're passing the buck. In other words, you're putting it off onto, and we're going to talk about that in a second as far as passing the buck in nursing scope of practice. So answer number three. This provides false hope. This is the answer that's talking about, yes, I hope he gets better too. That provides false hope. You don't know the outcome, and the fact that they're terminally ill probably means they are not going home. Answer number four does not address the spouse's feelings, and it could actually increase their distress by telling them that they always have a hard time with this. That's not helpful and can actually make it worse, and you're not addressing the situation. Answer two is the best answer. So answer two was, it sounds like this is difficult for you. Saying that, you're acknowledging how they feel. You're validating them and acknowledging them. What do you know about your husband's condition? It's an open-ended question that assesses that spouse's knowledge so you can determine what you need to teach them and what they understand. So that would be that best answer. So here's another select all of apply. And again, you can apply your true or false to each one to determine if each one is correct or incorrect. So which nursing responses indicate the use of therapeutic communication techniques? Select all that apply. So in other words, you got to know these different communication techniques to determine if they're correct or incorrect. So number one, I know how you feel. You think that's correct? That is not correct. That shows empathy. We don't use empathy. We use sympathy. You will do just fine. Wait and see. Don't worry about anything. You are in good hands. Why do you still smoke when you know that you have cancer? Let's talk more about the reasons you are not following your diet and you are feeling anxious because of the conversation that you had with your boss yesterday. So let's look at these again. I already talked about number one. I know how you feel. This is empathy. This is incorrect. You can say, I'm sorry for your loss. I'm sorry for what you're going through, but you can't put yourself in their situation. You will do fine. Just wait and see. This is that false reassurance. You have no idea what the outcome will be. Even if it's a routine procedure, you have no idea. You cannot provide false hope. And it minimizes their feelings as well. It's blowing them off. Oh, you'll be fine. Number three, this also avoids the client's feelings and it provides false reassurance. Number two and number three are almost identical. It's saying, don't worry, it'll be fine, no big deal, get over it. You know, those are all kind of that not addressing the patient's feelings and you're giving false hope. So number four, why do you still smoke when you know that you have cancer? This is a why question. Again, it's criticizing. Think about how it sounds. Why do you still smoke when you have cancer? As opposed to saying, tell me some reasons you still smoke, or let's talk about your smoking when you have cancer, for instance. Why sounds very demoralizing. Don't use why. So number five and number six are your two correct ones. So let's talk more about the reasons. You're getting information from the patient, and it's an open-ended question, so you're going to get more information. Number six, you're basically reiterating the patient's feelings. You're acknowledging their feelings, so you're feeling anxious. You're saying, this is what I interpret you to be saying with what with our conversation. So the last part, again, this is focused on the job of the nurse. Again, you have to know the scope of practice for yourself, as well as unlicensed assistive personnel and LPNs, because you have to know delegation, but you also have to know part of the job as the nurse and things that would be wrong. So you always have to do something. If an answer says do nothing, it is incorrect. And remember, actually taking a task is not always the only things you can do. Continue, if it says the value is normal, we'll continue to monitor, that's a task. That is something you're doing. So that's not incorrect. Never pass the buck. Again, back on that question with the therapeutic communication of asking, have they talked to the doctor about their condition? Well, that's passing the buck. You as a nurse can provide teaching. So saying things like, has the doctor talked to you, is passing it the buck when you don't have to. Do not leave the patient in distress. So in other words, if you have a patient who is having some kind of reaction, you cannot leave the patient's room to go get supplies. Remember, in NCLEX world, it's a perfect world where you have doctors at the ready, you have assistants at the ready, you have all the supplies you need available. So you leaving the room to go get supplies or go get help is never going to be an option. And likewise, you cannot place a task on the patient or family. So for instance, let's say you're caring for a patient who's having a seizure. Two answers that you can already take off that would be incorrect is if you go to the nurse's station to get help, or if you send the patient's family to the nurse's station to get help. Both wrong. And again, do not operate outside the nurse's scope of practice. If it's something you have to know what nurses can or cannot do to understand that scope of practice. If it is to do a thoracotomy or to do a cricotomy, to do anything that a nurse cannot do in practice, then you cannot do it. And this goes into practice as well. Even if you're not at work, if you're on the side of the road and you do something that's outside of your scope of practice on somebody that's been in an accident, you can get charged with some serious offenses. This goes with getting consents as well, making sure you're doing the proper, staying in your scope of practice as far as getting informed consents. So the last page, I just want to show you some resources. This first one, that says NCLEX strategies. It's the same paper that is uploaded to your introductory documents. It's just a list of techniques. So some books I would recommend, and I have hyperlinked the ISBN numbers that will take you directly to Amazon, where you can find these books if you wish to review them more. This one, I really like the one that's called Strategies for Test Success Passing Nursing School and the NCLEX Exam. It just gives you ideas of essentially a lot of the things I've talked about in this presentation. The Davis's Q&A and the Saunders Comprehensive Review, you have more than likely already purchased it or will purchase it in fourth term for the Saunders Comprehensive Review. Personally, I like the Saunders a little bit better than the Davis book, but they both have excellent methods of teaching you how to do those questions, and they give good rationales and tell you test-taking tips for how not only is the information in the answer correct, but those techniques like I've talked about in this presentation, how you can use those to get there. So again, each of these is hyperlinked. If you go to the PowerPoint that is posted on your Blackboard, you can use those hyperlinks to go directly to those books on Amazon if you wish to purchase them. I think they're very helpful strategies. And don't forget your ATI. Just because something is not assigned an ATI, there are lots of modules that you can play with in ATI to help you be successful. So I hope this presentation was helpful to you to help you understand some techniques that you may be able to use when you're slipping up on the content.